Something sticky is building up in your body right now. And if you ignore it, your sinuses and chest can feel heavier every single day. Not because your body is failing, but because thick mucus gets trapped like wet cement when you don't thin it and move it. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share simple, science-backed health tips like this every single day, and the next video could be the one your body really needs. Over the years, one pattern keeps showing up again and again. People struggle with clogged sinuses, postnasal drip, chest congestion, and that stubborn need to clear the throat. But they keep reaching for the wrong fix. They try stronger and stronger products when the real answer is often simpler. Today, I'm going to show you natural ways to loosen mucus in your sinuses, chest, and lungs using things you can drink, chew, or use at home safely. And by the end, you'll know exactly which one to start with first. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. Mucus is not the enemy. Your body makes it for a reason. It traps dust, germs, smoke, and pollen, so they do not go deeper into your lungs. The problem is not mucus itself. The problem is thick, sticky, trapped mucus. Think of it like this. Healthy mucus is like a light jacket zipper. It moves smoothly. Thick mucus is like old gum stuck in the zipper teeth. Everything jams. The tiny hairs in your airways, called cilia, are supposed to sweep mucus out like little brooms. But when mucus gets too dry, too inflamed, or too heavy, those brooms cannot do their job. And no, thick mucus does not always mean you need antibiotics. A lot of congestion comes from dry air, allergies, viral infections, smoke, reflux, or irritated airways. In fact, a 2020 review from the University of Oxford found that honey relieved upper respiratory symptoms, especially cough, better than usual care in many cases. That tells you something important. Gentle, natural support can matter more than people think. Here's the other mistake. People chase dramatic fixes. They want a miracle tea, a magic pill, or a powerful spray. But mucus usually clears best when you do two simple things. You add moisture and you lower irritation. That is the real game, not blasting the body, but helping it move again. So let's count down the natural ways that can actually help. Number 5, plain water and warm drinks. Most people think plain water is too boring to matter. But actually, this may be where everything starts. If your body is low on fluid, your mucus gets thicker. And thick mucus is harder to move out of the nose, throat, chest, and lungs. Let me be clear. Your body does not pull mucus out with force. It slides it out. That sliding depends on moisture. A 2020 study approved at Brunel University, London, found that even mild dehydration hurt small airway function, and oral rehydration helped restore it. In simple words, when your body dries out, your smaller breathing tubes do not work as smoothly. When you rehydrate, they work better again. That makes sense, right? If you leave gravy on the stove too long, it thickens. Add a little liquid, and it loosens. Mucus behaves the same way. So what should you do? Start simple. Sip water across the day instead of chugging one big glass at night. If you wake up with a dry mouth or a stuffed nose, drink one full glass of water within 15 minutes of getting up. Make the next drink warm if you can. Warm water, warm lemon water, weak herbal tea, or a light broth can feel especially soothing because warmth helps loosen secretions and calms the throat. A good starting goal for many adults is 6 to 8 cups of fluid a day. Sometimes more if the air is hot, dry, or you have a fever. But if your doctor has told you to limit fluids because of heart failure, kidney disease, or another condition, follow that advice first. That part matters. If you want a practical routine, try this. 1 glass of water in the morning, 1 mug of warm fluid mid-morning, 1 glass with lunch, 1 warm drink in the afternoon, 1 glass with dinner, then adjust based on your thirst, urine color, and doctor's advice. Pale yellow usually means you are doing okay. Dark yellow is often a clue that you need more. And ask yourself this. Have you been trying to clear mucus while barely drinking anything all day? That is like trying to mop a floor with a dry sponge. But wait until you see number 4. Number 4, honey. Most people think honey is just an old home remedy from grandma's kitchen. But actually, honey has stronger research behind it than many people realize. A 2020 study from the University of Oxford found that honey beat usual care for cough symptoms, and reports on that review showed it was 36% better at reducing cough frequency and 44% better at reducing cough severity. That is not small. Why does honey help? First, it coats the throat. That can calm the urge to cough, especially when mucus is dripping from your sinuses down the back of your throat. Second, it may help reduce irritation, and less irritation often means less coughing, less throat clearing, and more restful sleep. Here's the thing, when you cough all day, your throat gets angrier. Then the irritation itself causes more coughing. It becomes a loop. Honey can help break that loop. The easiest way to use it is 1 to 2 teaspoons by itself, especially before bed. You can also stir it into warm water or warm tea. Not boiling hot, warm is enough. If it is too hot, it is just harder on the throat. Some people like honey with a squeeze of lemon. That is fine, as long as the lemon does not trigger reflux for you. And please do not overcomplicate it. You do not need a giant recipe with 10 ingredients. 1 teaspoon slowly swallowed can do a lot. If you have diabetes, this is where you use common sense. Honey still affects blood sugar. A small amount may be reasonable for some people, but you should count it as part of your carbs and follow your doctor's advice. If you are trying to calm nighttime cough, sometimes 1 teaspoon is all you need. Quick question. Have you been dealing with throat clearing, postnasal drip, or a cough that gets worse at night? Comment yes or no below. Now let's keep going. Number 3, ginger. Most people think ginger is only for the stomach, but actually, ginger may help irritated airways too. A 2024 study from Columbia University found that adults with mild to moderate asthma who took 1 gram of oral ginger twice a day improved on 3 different symptom scores by day 28. The researchers also found changes in airway-related inflammatory markers, which means ginger may help calm some of the fire inside irritated breathing tubes. Now, asthma is not the same thing as sinus mucus, let me be clear about that, but both involve inflamed airways. And when your airways are irritated, they often make more mucus. So lowering irritation can sometimes help mucus feel less stubborn. Think of ginger like turning down the heat under a frying pan. If the pan is too hot, everything sticks and burns. Lower the heat, and things move better. That is what you are trying to do in your airways. Not force mucus out, but make the environment less sticky and angry. The easiest method is ginger tea. Slice 4 to 6 thin pieces of fresh ginger into a mug. Add hot water. Let it sit for 10 minutes. Sip it slowly. You can add 1 teaspoon of honey if you want even more throat support. Another option is adding half a teaspoon of grated ginger to soup, oatmeal, or warm broth. Can you chew ginger? Yes, in small amounts. A thin slice or a little grated ginger with food may help some people, but do not go overboard. Too much can irritate the stomach, and this part is important for older adults. Ginger can interact with blood thinners in some people, and larger amounts may increase bleeding risk. If you take warfarin, apixaban, rivaroxaban, clopidogrel, or even large daily aspirin doses, ask your doctor before using ginger supplements. Food amounts are usually much milder, but caution still matters. So no, ginger is not magic, but could a warm ginger drink calm the throat, comfort the chest, and help you feel less congested? For many people, yes. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. Now for the one people often skip, even though it may help the fastest. Number 2, salt water rinse and gargle. Most people think salt water is old-fashioned and weak, but actually this is one of the most practical tools you have. Why? Because it physically moves mucus out. That is the key. Some remedies soothe. This one flushes. Picture your sinuses and throat like a sink trap. If slime and debris keep sitting there, everything backs up. Saline, which means salt water, helps wash that buildup away. It can loosen sticky mucus, reduce swelling, and help your nose drain instead of clog. And yes, there is real research behind this. A 2024 trial involving researchers from UT Health Houston, Baylor College of Medicine, Harvard Medical School, and Trinity University found that people who use saline gargling and nasal rinsing had lower hospitalization rates than a reference group during SARS-CoV-2 infection. Another 2022 study from Augusta University found that adults age 55 and older who started nasal irrigation early had hospitalization rates of 1.3% compared with 9.47% in a similar reference group. Now, that does not mean salt water is a miracle cure, but it does show that a simple rinse can matter more than people expect. So how do you do it safely? This part matters a lot. Use distilled water, sterile water, or water that has been boiled and then cooled, not straight tap water. I am not saying this to scare you, but rare infections from unsafe water can be very serious. A basic homemade saline mix is simple. Use 1 cup of sterile or previously boiled water, add about half a teaspoon of salt, and a small pinch of baking soda if you want it gentler. Stir until dissolved. For the throat, Gargle for 20 to 30 seconds, then spit it out. For the nose, use a squeeze bottle or neti pot exactly as directed, leaning over the sink and letting the fluid flow through one side and out the other. Do it once a day when you are mildly congested. Do it 2 to 4 times a day when symptoms flare if your doctor says it is okay. Many people feel a difference right away. And here is the part people forget. Clean the bottle after every use. Let it air dry completely. Otherwise, you are just putting germs right back where you do not want them. If your mucus sits mostly in the back of your throat, gargling may help more than you think. If it sits behind your cheeks and nose, the rinse may help more. If you have both, doing both can make sense. I'd love to hear your story. What made you click on this video today? Share in the comments. And now, the most misunderstood one of all. Number 1. Spicy foods and capsaicin. Most people think spicy food only makes the nose run for a few minutes. But actually, that short burst may be exactly why it helps some people. Spicy foods contain capsaicin, the natural compound in chili peppers. Capsaicin can trigger watery drainage, which may temporarily thin out thick nasal mucus. Here's where the science gets interesting. A 2021 study from McGovern Medical School at UT Health Houston found that intranasal capsaicin improved rhinitis symptoms and reduced nasal congestion, with a 40% responder rate at 12 weeks. Then a 2024 follow-up from the same team reported improvement in 80% of enrolled patients with non-allergic rhinitis. Now, let me be very careful here. The strongest research used capsaicin in the nose, not just eating spicy tacos. So I am not saying chewing peppers will do exactly the same thing. But the reason spicy foods make your nose run is linked to the same natural compound. For some people, that temporary drainage can help break up the stuck, pressure-filled feeling. The easiest way to test this is gently. Add a small amount of chili, cayenne, horseradish, or wasabi to warm soup or broth. Start tiny, I mean tiny. About 1/8 teaspoon of cayenne in a full bowl of soup is enough for a first try. Or take a pea-sized amount of horseradish with food. Then wait and see how your body responds. If your nose opens and starts draining, that may be useful. If you just feel burning and miserable, that is your answer too. Do not use this approach if spicy foods trigger reflux, stomach pain, mouth sores, or diarrhea for you. And if you already have a raw throat from coughing, too much spice can make you feel worse instead of better. So what makes number 1 powerful? Not that it is dramatic, but that it can quickly turn thick, stuck congestion into thinner, moving drainage in the right person. Now let's pump the brakes for a second. I'm not saying this to scare you, but not all mucus is harmless. If you have chest pain, shortness of breath, wheezing that is getting worse, fever that will not settle, coughing up blood, blue lips, or you feel weak and confused, that is not a kitchen remedy moment. That is a call your doctor now moment. The same goes if your sinus pressure lasts more than 10 days, gets much worse after seeming to improve, or comes with one-sided facial swelling or severe tooth pain. And if you have COPD, asthma, heart failure, kidney disease, diabetes, or immune system problems, you need to be more careful with any home remedy. Honey can raise blood sugar. Ginger can interact with blood thinners. Saline rinses must use safe water. Spicy foods can worsen reflux. And if your doctor has you on fluid limits, drinking extra water without guidance may not be right for you. Also, green or yellow mucus does not automatically mean you need antibiotics. Color can happen when your immune system is doing its job. But if symptoms are severe, keep dragging on, or you are breathing harder than usual, get checked. So you're convinced, but thinking, how do I actually do this? Start with the easiest thing first. Tomorrow morning, drink 1 full glass of water when you wake up. Then have 1 warm drink before noon. If nighttime cough is your main problem, add 1 teaspoon of honey before bed. If sinus pressure is your main problem, use a safe saline rinse once that day. If you notice your nose opens with spicy soup, use a small amount with lunch or dinner. You do not need to start all 5 at once. In fact, I would rather you test 1 or 2 for 3 days and pay attention. Which one helps your throat? Which one helps your chest? Which one helps you sleep? If money is tight, start with water and homemade saline. Those are usually the cheapest. Honey and ginger are still simple options. Fancy supplements are the last thing you need, not the first. Look, there's a lot of noise out there, but clearing mucus is usually not about doing something extreme. It is about thinning it, calming irritation, and helping your body move it out the way it was designed to. You don't need to overthink this. Start with just 1 change today. A glass of water, a warm drink, a teaspoon of honey, a safe saline rinse, a little ginger. Your body will tell you if it's working. because you'll breathe easier, cough less, and feel less heavy in your face and chest. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong.